Hi, I'm Dr. Lisa Defusco. I'm a pediatrician here at Ochsner Rothschild Clinic. I also work at the Defusco Clinic. And today I will be talking about sports injuries and concussions. So it's been a big topic now in the news and in the media, especially with the NFL's new guidelines about concussion management. So most parents are concerned about their children, especially if they play football, about concussions. Usually, the definition of a concussion is you have to have force to your head. So it's usually if a kid is tackled and fall, or in any sport, has a bump somebody in the head. And a concussion is also known as traumatic brain injury, which sounds a little bit more scary than a concussion. How, as a parent, would you know if your child sustained a concussion? Most parents automatically think that they need to have loss of consciousness, and that is not true. They can actually still be awake and not lose consciousness for a concussion. Signs and symptoms of concussions are sort of broken down into four different areas that you can look at. The first area would be physical signs and symptoms: a headache, nausea and vomiting, sensitivity to light, sensitivity to sound, almost signs and symptoms of a migraine. And that would be your first symptom of a concussion. Secondly, the second part of this is cognitive functioning. So lots of kids will feel foggy, they will be forgetful, unable to concentrate, just not thinking clearly. The next component of that is difficulty with their emotions, so an emotional component. They may feel sad, they may be angry, just more emotional than what they typically feel. And then finally, a lot of kids that have concussions have a hard time with sleep. They have difficulty falling asleep or difficulty staying asleep, or they may have they may always be sleepy and difficulty to arouse. So those are some signs and symptoms that you can look at to see if your child has a concussion. So if your child does have a concussion, the next question is, how do I treat a concussion? What we refer to as brain rest. So that means many of these kids are unable to watch TV, play on the computer. They may have to have a lighter load at school. They may have to go to school half days, because your brain needs to rest. It needs to repair itself, and it needs time to just regenerate and rest. So that also means no sports and no contact sports, and also not a lot of bike riding or just any type of sport which would make them at risk for sustaining another head injury, because concussions build upon themselves. So if your brain is injured and you have another hit on top of that, it amplifies the injury. Most of the time we'll refer to one of our sports medicine specialists for the testing, and they will follow and then clear the patient for sports. In general, a concussion, it's usually 7 to 10 days it takes for a child to feel better, and it's once all of those symptoms go away. They no longer have a headache, they no longer feel foggy, they're remembering things, and they're back to their old self. For more information, please visit ochsner.org/children.